how can we stop this escalating rate of childhood obesity, which has increased 3 times since in the past 30 years. And because of that, our children are very much at risk of all the complications related to childhood obesity and early death.
To make sure that all our children are insured and that we provide a medical home for each of them.
We all know that genetics has a lot to do with obesity and environment has a lot to do with obesity. So biggest policy in the future is going to be trying to do the best we can to avoid children getting diseases of the elderly by eating the wrong foods, but making sure that those that are already obese do not suffer depression because the country tries to talk about them like if they were somebody who had caused this by themselves.
These rates have doubled and tripled. These consequences have profound effects for children as children, particularly, for example, diabetes, but they also have profound effects for the future, cardiovascular disease and other untoward health consequences. So we really have to focus on prevention now and helping our children not become obese, and if they are obese, return to normal weight.
I think that that diabetes is continuing to increase in our country and throughout the world. It's a major problem.
Engaging all segments of society, from government through education, through parents and church groups, to focus together on this challenge facing the country. If we don't work together, we won't achieve progress in childhood obesity.
I think the biggest challenges are just making us as a society take this on as an issue and changing the way we think about health. And we do it in a preventive way, in a community approach.
A lot of the federal programs that are funded through the states, whether it's the school breakfast and lunch program, whether it's the Medicaid program, whether it's the transportation programs that dictate what the environment that our kids live every day in, those programs don't consider health, and we've got to make sure that health is in every policy decision.
The ability to coordinate our efforts across various domains, whether it's within the schools and having policies that really support healthy behaviors. It's very clear that without, you can provide behavioral interventions and education, but without sound policies to support those efforts in a very concerted effort in schools, in our communities, we're not going to realize a significant reduction in childhood obesity.
Unfortunately, the way society has moved today in terms of technology and the focus that children now see of technology in their lives is not helping, shall I say. I won't say it's the cause of, but it's certainly not helping the issues that we have to deal with in terms of children being active, playing, running, bicycling, all the things that certainly I did and you did as a child.